Depression, it affects so many people, and many times treatment includes prescription meds that have unpleasant side effects. But there is a treatment center right here in the Valley that is changing the game and is truly different. This is Kevin Nicholson. He is a CEO of Ketamine Wellness Centers, and he is along with his patient, Michael Neidhart, and his partner, Sage Byers. Great to have all of you here with us this morning. I want to start with you. What is your center? What do you do there?
So Ketamine Wellness Centers is an outpatient infusion center that treats treatment-resistant depression, PTSD, OCD, suicidality, and certain neuropathic pain conditions with low-dose ketamine infusions.
And so when you're talking about treatment, that's a lot that you're covering. What specifically are you looking for in patients?
Well, the biggest thing is, one of the things that I want to touch on quickly is the fact that people hear ketamine, they think veterinary medicine, they think Special K, something along those lines. The dosages are much different. It still is a viable treatment option for patients, but we utilize it in a low capacity in a controlled setting to optimize the patient's outcome.
Absolutely. And Michael, you are one of those patients that Kevin had a chance to see. You were suffering from depression. Walk us through what you were dealing with.
Well, I had just gotten to this very dark place in my head, and it was just kind of ruining everything I had in my life, and I have so much. And ketamine kind of turned everything around and really gave me a 180 and really kind of turned on the lights in my head.
Right, and you, he's kind of young, and you said you treat all patients for depression, starting as how young?
The youngest that we've treated is 12, and we've treated as old as up into their 80s.
So how do you feel today, Michael, in comparison to your first appointment?
So much better. So much better. It just turned me around completely.
And Sage, you were by Michael's side throughout this entire transition. How has he changed?
Oh, it's been night and day. It's been a complete 180. He would be really lethargic, really withdrawn, but now he's back to his old great self.
Oh, I love that. And Michael, did you know you were slipping into depression?
Yeah, it'd been a long time coming, and I had been slipping into it for quite a while.
So when someone comes to see you and they walk in, do they always know what they're suffering from, or how do you know what to treat them for?
Well, we do a complete psychological examination. Dr. Ellen Diamond, who's our clinical psychologist, and Dr. Murphy, who's our anesthesiologist. We do both a medical and a psychological evaluation to look at all the conditions that the patient may be experiencing.
And Michael, when did you first notice a change?
Immediately.
Immediately. Is that?
It's not uncommon. It's amazing, and it can really, what's beautiful is that patients who struggle for so long, and it has been proven to be effective in acute suicidality as
right,
well.
And I want to talk about that because this is National Suicide Prevention Week.
Correct.
Can you give us some stats, and can you talk about some of the stigma that is associated?
You're right. There is a
suicide?
huge stigma around that, and the biggest challenge is people don't talk about it until somebody like Robin Williams passes away, unfortunately. And the biggest challenge is that for every patient who does take their own life, usually there's about 25 who've attempted to take their life and haven't been successful. So there has been research done that has proven that ketamine can be very effective in rapidly reducing suicidal ideations.
Right. So do you believe in this treatment? Michael, do you believe in it? Would you recommend it?
Absolutely. I think anyone who is suffering from what I was going through, or pain, or anything else, could really benefit from this.
And do you feel like a whole new man?
Better version of myself, I'd say.
I love that. And Sage, you've been smiling since you walked in because you got him back.
Yeah, I have. He's the man that I've always loved.
That's perfect. And you recommend this for people of many different ailments, right?
Yeah, we look at all patients who are coming in and look at different unique conditions or anything that they may be struggling with. We're going to do a complete assessment and make sure it's an appropriate treatment for them before we decide to go forward.
Wonderful. Well, continued success to you in your recovery. Let's give you some information. If you want to find out whether ketamine therapy is right for you, they are located at 2152 South Vineyard, Suite 131, that is in Mesa. Give them a call. That's 855-KET-WELL, or go online to KetamineWellnessCenters.com.